Our behavioral health model is one of my favorite things about Crusader. It's actually one of my very favorite things to brag about. My name is Melissa Hartzell. I am a family medicine PA, and I currently serve as the lead advanced practice provider for adult and family medicine.
Crusader Community Health has an integrated model of treatment for behavioral health. That means mental health services are provided in a primary care setting. Patients can receive their primary medical care and behavioral health care all at one site, with collaboration and coordination between providers.
If you have the integrated model, this is just part of the healthcare team. My name is Jen Venters. I am a pediatric nurse practitioner, and I am the team lead here at Crusader Community Health for pediatrics. Behavioral health providers are able to see patients same day potentially. They can come down and help triage situations, or we can at least get them an appointment before they leave with that provider so that they come back to a location that's familiar to them.
Crusader receives funding from the Winnebago County Community Mental Health Board and half-cent sales tax. Voters approved that tax in 2020 and again in 2024. That funding reinforces Crusader's ability to expand access to behavioral health care, which means hiring case managers and support staff.
We are able to do warm handoffs, so I'm able to speak with a behavioral health provider. They're able to speak with me. It's a communication that doesn't normally happen between primary care and behavioral health, and so we're really fortunate that we're able to have that. Hi, how are you?
Mental health tax funding also makes it possible to provide on-site telepsychiatry services for established patients.
One of the things that Crusader does really well is we try to figure out what the gaps in the community are. And one of those huge gaps, especially for mental health, was our patients could not get into psychiatry. The majority of this comes because of a lack of insurance or the type of insurance that the patient has. Many of the psychiatry offices in the community only accept private insurance, or you have to pay out of pocket for each appointment, and that's just not a realistic option for most of our patients.
Patients referred to psychiatry need additional specialty care, oversight, or medication that's outside the scope of Crusader's medical or behavioral health providers. Thanks to the Mental Health Board grant, patients can now receive that specialized psychiatry care right here at Crusader, using the same discount programs as our other specialty care services. This program year, funding from the Winnebago County Mental Health Tax supported 2 part-time adult psychiatry providers, 1 part-time child and adolescent psychiatry provider, and more than 1,200 patient visits for psychiatric services at our Alpine and Loves Park clinics. We provided psychiatric services to about 350 patients. More than a quarter of those were child and adolescent patients seen on-site right here at Crusader. Psychiatry visits happen using a telepsychiatry model. Patients come to Crusader, check in, and meet virtually with a psychiatric provider. The process is facilitated by a Crusader medical assistant.
This helps make sure that any kind of access to electronics, internet is not a concern. We want people to feel comfortable in a place that they're familiar with.
Our patients can now get the care they need without delays. We're preventing ER visits, we're preventing hospitalizations, we're helping keep patients in the community functioning the way that they want to function, working, doing the things that they enjoy on a daily basis, because they can access psychiatry services here at Crusader now, instead of trying to find something in the community where things were really lacking before.
In the most recent patient survey on psychiatry services, 90% said they were able to get an appointment in a reasonable time frame. 97% said the provider spent enough time with them, and 90% felt heard, understood, and supported in their session.
It's how medicine should be done, and we're finally able to do that.
It's been such a rewarding thing to see the program grow, but also to be on the benefiting end as a primary care provider and watch how it has changed my patients' lives.